Some healthcare leaders view these possible Medicare cuts as a serious threat. However, Congressman Calvert argues Medi-Cal is not the focus of government spending cuts.
People in need, those most in need in the Valley, those that are, kind of fall through the cracks of care, for care, those that are really underserved.
According to the Healthcare Workers Union, over 250,000 people in Riverside County rely on Medi-Cal. Here at Eisenhower Health, it's critical to their operations.
25% of our volume in the ER is actually Medi-Cal patients.
But as a new administration pushes for major government spending cuts, some are worried that Medicaid would be a part of those slashes. While it's not for certain that Medi-Cal would be a part of those government spending cuts, the chief operating officer from Eisenhower Health explains what it would mean if those cuts did go through.
Some of the cuts that are being proposed right now to Medi-Cal, I've heard as high as 20% cuts. I know that in Washington, they've got proposals on the table of nearly $2.2 trillion in cuts over the next 10 years. Would be devastating to take another 20% cut out of what is already a shortfall in coverage.
One representative from the Healthcare Workers Union shares her fears that these cuts could be a real possibility.
If there are any cuts to Medi-Cal, which we believe could really happen, that this is a real threat, that this could destabilize our entire healthcare system and raise costs and reduce access for everyone.
News Channel 3 reached out to Congressman Ken Calvert to see how legitimate those threats are. He assures residents that Republicans will not touch Social Security or Medicare benefits. He says, quote, "We are not interested in cutting the social and healthcare safety net for children, disabled, and low-income Americans. We're focused on eliminating waste, fraud, and abuse, as well as strengthening work requirements for able-bodied working-age adults with no children." That waste he's referring to is better known as Medi-Cal fraud. Some individuals and providers fraudulently claim benefits, such as submitting false claims, billing for unnecessary procedures, or receiving benefits without eligibility. While Calvert says these cuts won't happen, for Ken Wheat, Eisenhower COO, it's a waiting game.
No idea what's going to happen. We'll have to wait and see, but hopeful that they can come to some agreement that is workable, because it would be devastating what's on the table right now.
In Rancho Mirage, Ali Anthony, News Channel 3.